Hello everyone, today we are going to tell you about emerging technology in healthcare and more specifically the usage of nanobots to perform internal surgeries and evaluations. This idea has been introduced in many science fiction movies, such as the 1966 movie Fantastic Voyage. However, it is very quickly becoming a reality. The idea of using tiny robots inside human bodies was first proposed by Nobel Prize winner Richard Feynman. He came up with the idea of a tiny robot that swims inside blood vessels, finds the issue, and performs surgery. Mechanical engineer Brad Nelson and his team at the Swiss Federal Institution of Technology are coming up with micro-robots that enter the body and are guided from the outside through magnetic fields. Scientists from the ETH Zurich and the Technion Israel Institute of Technology report that they have designed new nanorobots capable of wading through bodily fluids with relative ease. These robots can perform checks to ensure there are no cancerous cells in the body and give medication to the areas that require it.
The robots are made in a clean room environment to keep them sterile, much in the same way as computer chips. The nanorobots are built upon a single strand of DNA which is combined with short synthetic strands of DNA designed by the experts. The nanorobots would screen every cell in the body for cancers or abnormal cells and destroy them before they spread. Scientists from ETH Zurich and the Technion Israel Institute of Technology report that they have designed new nanorobots capable of wading through bodily fluids with relative ease. The devices were made by stringing together a piece of polymer together with two magnetic metal nanowires. This formed a three-piece chain about as long as the width of a silk fiber, which they then put to the test in a fluid that was thicker than blood. The team then applied a wavering magnetic field which caused the nanorobot to move in an S-shaped motion, just like the tail of a tadpole. This saw it swim along a speed of almost 1 body length per second. The researchers say that the magnetic field can also be used to dictate the direction the nanorobot swims in, meaning it can be aimed toward its target.
Many models and versions of microbots and nanobots have been made by multiple organizations such as the Swiss Federal Institution of Technology, ETH Zurich, WIS Institutes, and the Technion Israel Institute of Technology. What most of these models have in common is the usage of magnetic fields for mobilization. The flagella of the E. coli bacteria was considered as a model. A structure similar to the bacteria's tail would be ideal, but it would be difficult to create a motor small enough to fit in the nanobot. For this reason, most of these models include the usage of magnetism for movement. The tail-like end would be magnetized and then controlled from outside the body. Another option that was looked at was using micromotors powered by gas bubbles that rise from reactions in the stomach. A little robot would enter the bloodstream and move through the body to the desired area. It would then survey the area, analyze what needs to be done, take out a little knife, and begin the surgery. WIS Institute's model consisted of strands of DNA folded together to create a shape similar to a barrel capable of holding substances. The double helixes at the end act as a door and only open to release the fluid when specific molecules or particles on cancer cells come into contact with it, acting as a key. Other models would be injected into the bloodstream and would release medicine directly on the affected area. They screen the body and analyze body cells for signs of cancer or other conditions which are undetectable from the outside. All the institutions had two main parts they needed to figure out: how to make the robot move and how to let it know when to perform its function. Most of them used a magnetized tail-like figure for movement, and sensors or triggers to signal the beginning of the procedure required. Okay, so this is the example of how a nanobot would look like moving through the bloodstream.
This method of nanorobots has many societal and ethical advantages and impacts over invasive surgery and blastive drugs, which can be as painful and damaging to the body as the disease itself. Nanorobots are capable of rearranging atoms at the molecular level, allowing them to alter cell biology to fight disease and work more effectively. The ability to target diseases and disorders at the cellular level eliminates the risk associated with invasive surgeries or drug side effects. As the nanorobots do not generate any harmful activities, there is no side effect. The initial cost of development is only high, but the manufacturing by batch processing reduces the cost. Nanotechnology has the potential to bring major advances in medicine. Nanorobots could be sent into a patient's arteries to clear away blockages. Surgeries could become more faster and more accurate. Injuries could be repaired cell by cell. It may even become possible to heal genetic conditions by fixing the damaged genes.
Although nanobots would be extremely useful to the healthcare industry and make the lives of many surgeons and patients easier, there are a lot of negative effects to be taken into consideration. Many societal and ethical issues would arise, such as what would happen if control over the robots was lost while they were inside the body. An unguided robot could hurt the body and damage organs, or get lost and interfere with our body systems. Billions of nanobots can fit into 1 teaspoon and are not visible to the naked eye. If one of them were to get lost inside the body, it would be close to impossible to try to get the robot out. The impacts of these societal and ethical issues could reach beyond healthcare and possibly affect the economy as well. If fewer surgeons are required, many people will lose jobs and there will be fewer positions available. Since the robot can perform multiple types of surgeries, we would only need a doctor to maneuver the robot. We would also require fewer nurses, as there would be no need of them for assistance during the surgery or afterwards to take care of the patients. We could become dependent on these robots, and it could result in a major problem if they aren't available.
Here's a fun fact. In the James Bond movie, Casino Royale, Bond is injected with a microchip that tracks his location and monitors his vital signs. However, when he's captured by the bad guys, the device is cut out of his arm, making it useless. M16 seems to have learned their lesson in Spectre, because this time around, Bond is injected with smart blood, consisting of nanotechnology that does the same thing while flowing microscopically through his veins, just like the nanorobots that we explained are used for medical care. In conclusion, these nanorobots are not only helpful in healthcare, it is also helpful in military, computing, environmental effects, and many more. This is the future in medical care. It can save a lot of time and money, but also improve the lives of many people by stopping a number of diseases before it spreads throughout the body.
Thank you for watching our video. We hope you enjoyed it.